Aloha, my name is Bernie Rubin. I'm the Chief of Rheumatology at Henry Ford Hospital in Detroit. I'm here at RWCS 2018. We have several fellows who have interesting cases that they have chosen to present. So I'm going to talk to Umber Ahmad from the Medical College of Wisconsin. She's a first-year fellow about this interesting case of cutaneous polyarteritis nodosa. So, Umber, several of us in rheumatology see polyarteritis nodosa, even cutaneous. What's unusual about your case?
So yeah, my patient was actually pretty interesting. She was a 37-year-old female who had cutaneous polyarteritis nodosa since she was a young child, and usually was preceded by a strep infection. At this time, though, the reoccurrence happened when she was 37, and she was initially treated with Cytoxan, but didn't really have much of a response with it. When they tried to decrease her dose of prednisone down to less than 40 milligrams a day, she had reoccurrence and worsening of her subcutaneous painful lesions.
Okay.
And so she came to us wanting help and trying to figure out what's going to be helpful in regards to these uncomfortable lesions and nodules on her body.
So how long had she been treated before she came to rheumatology?
Yeah, so she did around 3 cycles of Cytoxan, and so she was on the 40 milligrams of prednisone. We actually tried to first start her on methotrexate to see if she had any improvement with that. She had minimal improvement with that, and so we decided to switch her to Plaquenil from there onwards. And with Plaquenil, she didn't tolerate it. She was having complaints of irritated eyes, and so we retrialed it, didn't work out. So we went ahead with IVIG, which is not often done, and actually there's only 9 case reports of it done in the literature.
Really? And so you looked at trying IVIG, and did it work?
Yes, it did. What's really astounding is actually after the first cycle, she noticed remarkable improvement of her symptoms. And so after the second cycle, which is what she was on, actually she was on it last month, she has complete resolution of her symptoms and is down to prednisone about 10 milligrams a day.
Wow, that's very interesting. So there's only been a few cases in the literature where IVIG has been used?
Yes, about 9 cases total, and a few of them are in children as well as the rest of them are in adults. And often, I think of the cases that are in the literature, 3 of them were involved with children and usually preceded by a strep infection with an elevated ASO. And so, yeah, there's very limited cases, and specifically these are the ones involving mainly cutaneous manifestations.
So how many cycles of IVIG has she had?
So far, she's had about 2 cycles of IVIG, and her next one is going to be this month, and we're going to do a total of 6 cycles. But I guess based on all the cases, it really does vary. Some people do it for 6 months, some people do it for 3 months. It just really depends. But we thought we'd try the 6 months, see how she does off of it, and if she does great, we'll just keep her on that. But I think right now she's doing pretty good, and we're happy with the results.
Very good, thank you. That's a great case and very interesting. You know, many of us see this kind of a condition, and I think the use of IVIG might be something that all the rheumatologists would be interested in looking at in the future.
Yeah, I agree with that, especially when it makes such a big difference in symptoms of a patient. I think it's a wonderful medication to consider in this specific disease.
Thank you. Great.